prepare it. 4 topics. What are the 4 topics? Your topic, exam topic is differential leukocyte count, but for the step by step, you have to write the topics in the practical notebook as done in the step by step in the class. First topic is study of the compound microscope, right? First day. Second day is preparation and staining of a peripheral blood smear. This is the smear you are making. This is called a peripheral blood smear. Blood is being taken from your capillary or venous blood and you are making a blood smear on a slide. That is preparation and staining of a blood smear, peripheral blood smear. Next topic is identification of cells in a stained smear. Identification of blood cells, cellular components of blood in a stained smear. Whatever you write, identification of cellular components of a blood in a stained smear. This is the third topic. And finally, differential leukocyte count. In the exam, you will be asked to do the differential leukocyte. Take this blood sample, take your capillary blood and do this experiment, differential leukocyte count. Or the question may be framed directly. You may not be told. The question may be framed. You have to read the question and decide that you are to do differential leukocyte count and proceed. Like total leukocyte count will be given and you will be asked to count the number of neutrophils. So then the experiment you are to do, that you have to decide. The differential leukocyte count I have to do, and then total leukocyte count is given. So I take the percentage. Say neutrophils you get out of 100, you have counted 100 leukocytes, you get 60 neutrophils. So and now the total count is given, actual count which is given, and so you have to take 60% of that count and identify or calculate the number of neutrophils. So that is for the exam purpose. And for now writing this practical notebook, you have to write these 4 topics in order. Classes have started from 4th November. So your batch till now these are temporary groups, but you are doing your physiology practicals on Wednesday and Saturday. So one Wednesday, one Saturday, then one Wednesday, another Saturday. Write the dates like that and write these 4 topics and prepare your practical notebook. From next week probably we will move on to other topics. Just now, as you have not got your roll number, so we are not still asking you to submit as of now. You will write the name and roll number and then submit. That's why you are waiting. But topics have to be written right after the topics are done in the class. 4 topics. The topics are what you have done. Did you not attend from the first class? So first class was on study of the compound microscope. Then it was on preparation and staining of a peripheral blood smear. What you are doing? For doing the differential leukocyte count, these are the steps. You have to know about the microscope obviously, and then take the blood smear, collect the blood sample, either venous blood or capillary blood. For the beginners, always suggested it is capillary blood, because there will be topics where it is not possible to do with venous blood. So how to prick the finger, take the blood on the slide. So collection of blood sample, preparation of that sample and staining the sample. So the topic is preparation and staining of a peripheral blood smear. Next topic is, you have learned to identify the cells. How to identify blood cells in a smear, which are the RBCs, which are the different types of WBCs, even the platelets. Platelets in a Leishman-Stein smear are found in clumps. Platelets are even smaller in size than RBCs. Almost diameter is 1/5. Platelets, these will be also taught in theoretical classes. Theoretical classes you have, which topics have been done? Blood components, plasma proteins and hemoglobin. This has been done. Other hematology topics are still to be done. Okay, platelets are smaller in size. So those can also be identified. So identification of blood cells in a stained blood smear. Stained with Leishman-Stein. Here we are staining with Leishman-Stein. This is the third one. And fourth one is differential leukocyte count. Write like this. 4 dates, 4 topics. Write like this. A date you have to put the date. You put the date among Wednesdays and Saturdays in order. These topics have to be in order. Don't write questions and answers from the books. From the textbooks, don't copy questions and answers while writing the practical notebook. You have to write the principle, calculation and result. These are mandatory. These are what are needed. You may write the procedure in short, but not questions and answers from the textbooks. That is not how to write a practical notebook. Some people are doing, and then you are going, and what you are doing, some people are copying from the seniors. That is not the way to write a practical notebook. Practical notebook, what you have got in your practical lab, working in the lab, that result you are to write. So write the principle of the experiment, procedure you may write in short. Wherever calculation is there, obviously preparation and staining of blood smear, there will be no need, there is no scope for writing any calculation part, even not result part. That result you can write that I have got such and such blood smear, this blood smear, what should be the characteristics or ideal blood smear, you may write that. Not any questions and answers. In differential leukocyte count, you have to write about the calculation, draw those boxes and the result. So apply your intelligence and do that, and don't write questions and answers. Those are for studying and knowing about the topic and answering in the exam, and answering and having the knowledge, but not for writing in the practical manual. Practical manual, each topic you write principle, procedure, in short, calculation and result as applicable. No calculation in some topics, there will be no calculation part. Like in study of the compound microscope, there is nothing such. You write about the microscope, basic, what are the important points, what are to note, how to calculate magnification, these things, draw the picture of the microscope and label the parts. This is what to do in microscope. So these things are learnt at school level. Don't write questions and answers in the practical notebook. Looks very silly. So prepare this and keep the practical notebook with yourself. We will tell you when to submit. And work with capillary blood. Everybody should know how to prick the finger and take the blood on the slide and work like that. There will be topics where it is not possible, it is scientifically not possible to do with venous blood. And if the examiner wants in the exam, you have to do. The question may be there, take this hemoglobin count of this or this differential leukocyte count of your blood taken from a blood collected from a capillary vessel. So if that is the question, you have to prick your finger and do. So you can't ask for already stored blood or venous blood, or already stored blood doesn't give accurate results also. That is what we are taking, what you are supplied on the first day was anticoagulated blood, that is added with anticoagulant, stored from 2 or 3 days earlier. So always it is better to do on fresh blood. Prick your own finger and do it. If you don't practice pricking the finger, you can't do in the exam and you can't learn. You do it one time and then appear on the day of the exam, you can't take blood. It will be, if you squeeze the finger, tissue fluid will get mixed. So that is not the way to do. You have to put a deep prick 2 to 3 millimeters so that the blood comes freely. So I would suggest keep not lancet needles, keep 23-25 gauge needles with yourself. Obviously one needle is for use for one person, obviously, so that is safe. Also keep a 2 or 3 needles like that you get in medical stores. Keep 3-4 slides for your own use. Slides you can clean after use, dry it and keep it for use next time. So slides, so I would suggest that keep, and also at least this drawing of a smear you can practice at home also. Then you will not get stain and everything. You can practice at home. That means you are living in wherever you are living, in a hostel or wherever you are living, you can practice there also. Pricking the finger and making a good blood smear needs practice. So for beginners, if you do in the class one time and go on the day of the exam, you cannot do. So we are keeping already 2 weeks, 2 to 3 weeks we are keeping for this preliminary topic. We will move on to another topic, but you have to learn. By the end of the sessions, you have to learn and do, and you have to appear for certifiable competencies also. The whole syllabus is divided into so many competencies. Have you seen the syllabus? The CBM Curriculum Board of Medical Education, that has revised this in 2024 in the month of September. After the previous batch appear for their exams, the new guidelines came out. There have been certain modifications in the syllabus. So now, earlier there was no need to be certified. Some topics in hematology topics were not need to be. Those topics have to be certified that you by the faculties, that you know the topics well, that you have been competent in those topics to appear for the final exam, that means first prof exam in physiology. Those have to be certified by the faculties. These new regulations have come. So if you can't perform, then nobody will certify, then you are not eligible for the first prof exam. Remember that. Every topic, every hematology topic which we are doing, you have to be certified before the first prof exam.